Hello, my name's Dr. Mahmoud and I'm one of the medical consultants at the University Hospitals, Derby and Burton. So today I'm going to talk to you about the new changes to the MRCP PACES exam, which are due to start September 3rd diet 2020. Just to reiterate, for any of you currently revising for MRCP PACES, there will be no changes to yourselves. The changes are going to start third diet of 2020, which starts in September of 2020. The new changes to the PACES exam have been made in order to reflect the new internal medicine curriculum. There are some parts of the PACES exam that have been removed and other elements that have been changed, and I will go through the key changes. Previously, there was Station 2, otherwise known as the History Station, which was a 20-minute station dedicated to taking a detailed history. This has now been removed to make room for other stations. So the old Station 5 was an integrated clinical consultation, but there were two of them in 20 minutes, and it was felt that this was too tight for a lot of candidates to be able to do in a timely manner. What has happened is that these two consultations have been divided up and they're now 20 minutes. So 15 minutes is an integrated history, examination, feedback to the patient, with 5 minutes question and answers with the examiner. Previously, stations were either purely clinical or purely history-taking communication. This new carousel has changed and there will be a mix in the stations. If we talk through them, Station 1 will include a 10-minute communication station, which will be an interaction between the candidate and the patient only. There will be no question and answer between the candidate and the examiner. It will then move on to a 10-minute respiratory clinical examination station, which will be 6 minutes of examination and then 4 minutes of questions and answers with the examiner. Moving on to Station 2, this is going to be the new style clinical consultation. So if you like, a longer version of the old Station 5, but there'll be 15 minutes for history examination feedback and 5 minutes for question and answers with the examiner. Station 3 is going to be an entirely clinical carousel station, so 10 minutes of cardio, 10 minutes of neuro, and it will be the same as previously, so 6 minutes of examination with 4 minutes of question and answer time. Moving on to Station 4, this will be a 10-minute communication station, so again, just entirely communication, no time for question and answers at the end, and a 10-minute abdominal clinical station. Finally, Station 5 is the second and final clinical consultation station, so 15 minutes of history, examination and feedback to the patient with 5 minutes of question and answer time. Although the nature of the carousels has changed, the mark scheme with the 7 essential skills has not. So candidates will be assessed on physical examination, identifying physical signs, clinical communication, differential diagnosis, clinical judgment, management of patient concerns and maintaining patient welfare. So what this means for you as a candidate is that the marks for each skill assessed are evenly distributed amongst the stations. Previously, for example, you had some stations that were just clinical only and some stations which were history and communication, and those clinical skills were assessed. Because there has been a mix now of the clinical and the history and communication skills, no one station is more heavily assessed for one skill over another. If you'd like to know more, please go to the MRCP RCP website. The changes are clarified in detail there. The Royal College of Physicians is currently working on and will publish new mock cases and further information on the new exam style.